deliberately putting the policy aside now, if I could come to Ms Murphy with the greatest of respect, and we should have said this to you at the beginning of the session and not the end of it, but I did just want to leave a little space, and of course I come last in terms of questioning. Ms Murphy, you are, I think, we've had 16 public sessions now, and it is my understanding and that of the Secretariat that you are the first person before the COVID committee who comes in to speak to us and to attend with us as somebody who has survived and recovered from COVID. And if I could say thank you for doing that, and it's remarkable that it has taken this long for us to speak to somebody who has actually had COVID. Thank you for coming in. I don't want to ask you in an overly personal way about your experience of that, but recognising that your colleagues have also had, similar experiences, having contracted people whom you know well. I wonder if, as we know, for the benefit of this committee and for the benefit of the record of the House, and also for people who may be watching and thinking about what they're doing in their own movements and how they're approaching, their interactions with other people, I wonder, could you give us a sense of the general experience that you and those colleagues whom you've spoken to have had about how it is to have the illness without, in your own way?
Yeah, first of all, thank you for allowing me the opportunity to be here today and share my experience. I'm sure a lot of nurses across the country will resonate with what I have said today, and hopefully I've left some impact on going forward how we can improve the service if, God forbid, there will be a second surge. I can speak personally. We went from being a 31-bedded surgical ward to COVID positive ward only overnight. So we had only COVID positive patients admitted to our ward. We took on the task of the full multidisciplinary team as they did their remote reviews of their patients. We were on the ward at the bedside 24 hours a day, and that was an honour to care for patients. We really do. We love our job. That's why we're there. We bridged communication between patients and families using iPads. That's something we never had to do before. We undertook, the list is extensive, I could go on and on, but I suppose the biggest change for me personally and my colleagues who contracted COVID, speaking from my experience, on April 30th, so 6 weeks after we became a COVID ward, I became a statistic where I tested positive for COVID-19. Initially I was upset and quite angry, and that was across the board with my colleagues as well. As I had said previously, that I followed hospital protocol and I was competent in the use of PPE, but the emotions I initially felt were buried by the physical impact of COVID-19. I was crippled with fatigue, bedbound with headaches, I had extreme shortness of breath, which caused great distress as I felt like I was suffocating, and many of my colleagues had the same symptoms. I couldn't talk to my family or friends over the phone, was in complete isolation. I had lost a sense of taste and smell. Simple tasks such as washing and dressing or making a snack for myself was just unachievable as I was completely debilitated. I presented then to the emergency department about a week later as I was deteriorating at home. I was terrified. I have no underlying conditions, as I said previously, so this was a huge shock to me to be the patient in the emergency department in the hospital that I worked in. I was subsequently admitted for what I thought would be overnight observation, maybe 2 nights, and I was kept in for a week. I had a series of blood tests. I underwent a chest x-ray, I had a CT scan of my lungs, I had a CT scan of my kidneys and other organs, just to outrule any potential damage that the impact of COVID-19 can cause. As I've said previously, there is no pattern. For 6 days, I was on a heart monitor 24 hours a day as my heart rate went to 170 beats per minute. They said it was post-viral effects. So at this stage, I was negative for coronavirus, but yet I still had the post-viral effects. Just so the normal heart rate would be 60 to 80 beats per minute. I was on IV fluids, which are intravenous fluids to rehydrate me, and I was on daily injections to ensure that I didn't develop a blood clot, which I have experienced as the nurse. They can be potentially fatal, so that was a worry. The days and nights were extremely long in isolation. your concentration is affected massively. So even the TV on the background, you weren't paying any attention to it. I was relieved to get home about a week later from being admitted, and recovering in isolation is challenging both physically and mentally, as I previously stated, but I was unprepared for the psychological impact of contracting and living with COVID-19 that transpired. It has definitely prolonged my road to recovery, but I know I'll get there and hopefully go back to work at 100%. For the first time, I experienced acute anxiety, I experienced panic attacks, I have ongoing insomnia. Some nights I can sleep 8 hours, some nights it's 2 to 3. I don't know why. I have vivid hallucinations at the very start with COVID-19, as did some of my colleagues, which isn't spoken about. Everybody speaks about the physical signs and symptoms, but the psychological, as I've said, are just as detrimental in your recovery. 12 weeks on, as I said, still haven't returned to my pre-COVID health. I'm still experiencing some fatigue. One day I'll be fine, and the next I'll need to take a nap in the afternoon. Shortness of breath comes and goes as well, and I'm awaiting a lung function test just to be sure, to outrule that I have no lasting impact of COVID-19. And I also am very lucky that I have physiotherapy input, which I liaise with the hospital to regain my strength to get me back to work eventually.
Thank you. Thank you so much for outlining that for us. We really do appreciate it.